Yes. Done. Redirecting to. um, So in 2 minutes, we are going to go live, yeah?
Great.
Okay. Let me see if I can start to record this as well. Yeah. Okay. So there's a minute more. It's 11:59. So in 2020, the world's attention has been focused on the COVID-19 pandemic, on health, and how pandemic actually affects lives and livelihoods. COVID-19 is showing us once again how health is interlinked with certain critical issues, such as reducing inequality, human rights, gender equality, social protection, and of course, economic growth. So with this in mind, this year's theme of World AIDS Day is global solidarity, shared responsibility with resilience and impact. So we at AF take this opportunity, which is like this is the week for AIDS, raising AIDS awareness, and which started yesterday. So we are taking this opportunity to show solidarity with the millions of people living with HIV worldwide. So while it is important to bring HIV awareness, education about it, knowledge, so that people can save themselves and save lives, it's also important to speak out and shout out against the stigma that is attached to it, and increased response and initiate an increased response to end HIV epidemic. On the other hand, the holistic yogic science, which is yoga, Ayurveda, Vedic science, naturopathy, all of that, it points at how to live with the difficulties. So let's say with the epidemic in peace. So this is the yogic management of the mind and the focus, the silence, the acceptance, the tolerance, and which in fact is the healing principle. When you look at me, for instance, today, you think of Ashiki. I am not playing the Ashiki girl role right now. My life has been through a spinner, and I have moved from being self made to self healed, where resilience was an extreme test in my life. So I understand how crucial the mental health is to health in general, in recovery and in building the immune system, which the HIV patients so need. So we don't just need to end the pandemic or the epidemic. We need to accelerate the healing process. And I know that I've been through it. So there was a conception on a few years ago, I would say in 1993, for instance, when I was like on top of stardom and films and all that. And I endorsed Kama Sutra condom because it was believed at that time that AIDS is sexually transmitted through sexual intercourse, right? And through blood transfusion and etc. But today, today, we find that there are adolescents who are HIV positive. They never had sex, I guess, right? I went to this, so when I was researching and starting with my foundation about a few years ago, and I was aiming challenged people from low income groups and mainly children and adolescents. And I found out about this center that keeps HIV positive children and adolescents. And when I went there, and I mean, I cannot even, I still get tears in my eyes. I saw a 3-year-old when they told me he's HIV positive. And he was a 3-year-old, he was bubbly, he was moving around, you know, he didn't know that he had HIV. But I saw an 11-year-old girl, and her face was shrunken, and her body was like she was depressed because she understood that she has HIV. So as children grow up, it gets worse, and we find today that adolescence, therefore, is our focus. So therefore, the people we have some amazing people who have been working on HIV for a while and focus on adolescents. So Pallab Patangar was working. He was with. Now I want all of you to tell about you because I'm going to say very briefly 2 words sort of, and then I would. So you know how we are going to go through this. So I thought it'd be nice if we start off all of us. हाँ शिवानी हम लोग सब शुरू करेंगे ना क्या करेंगे हम लोग कि पहले 2-3 मिनट अपना इंट्रोडक्शन देंगे तो अपनी कहानी या हमारा कैसे मतलब जैसे आपकी कहानी इतनी इंस्पायरिंग है कि कैसे आप आई और कैसे आपका शुरुआत कैसे हुई सारी राइट each one of you has inspiring stories right
Right.
and then so we go through that then we start the second phase in which we will discuss how you are helping HIV. Yeah, so your work in HIV and and what you feel about it, and what are the challenges you are facing today because of COVID-19. Yeah, and then we will end that for 2 minutes. Each of you are going to speak, and the third is when we will come to a conclusion where we are going to say, okay, fine, this is the issue, this is what, and this is how we are going to raise the solidarity. Yeah. So, so I'm just giving an introduction. Pallab was with Humsafar right before, and now he's in the digital space, as I would say, of HIV. And then of course Shivani, वो transgender हैं और वो अपनी कहानी में ऐसा बताती हैं किस तरीके से उनको she has a fear of AIDS. Dharmendra has not yet joined us, so I will keep his introduction. And then Apurva is from UNICEF, and Apurva, of course, and I share more than just well-being of people because we both are swimmers and we both love to run and we both love sports. And this is where Elvis comes in, who is in the digital space of, not sorry, in the digital space, but in the sports space of HIV/AIDS, and he's done some remarkable work and I'm sure that all of you would love to hear what he's been doing, some international work that he's been doing. So I think that we start with Palak. We start with you. So you got like what 2 to 3 minutes to talk about your background.
Yeah. Thanks, Anu. Just as a brief story, I at 18 I came to terms with being a gay man in Mumbai, and of course, HIV was at the helm of in the 90s. It was very little was known, and it was entering the country. I started my volunteer work with Hamsafar Trust, and then went on to head the programs in Hamsafar from 2009 onwards, and somewhere in 2016. I decided to move from specifically the MSM transgender space to the technology space. And as a business management graduate who's worked in corporates, I felt I needed to use my skill sets of understanding what was happening in the public health space to understanding what was happening in the technology space and bringing the two together. So now my work, after having understood how HIV programs work and how things people get affected. There are different key populations, from men who have sex with men to transgender groups to children, adolescent children to female sex workers to also intravenous drug users. Each of these typologies have their own problems and their issues, and technology can end as an enabler for some of the programs on the ground, and improve the program efficacy on the ground. I'm not saying that technology will replace programs on the ground. Technology, as I said, I'm repeating, it will enable the health workers and the key populations on the ground to get better health services and access to healthcare. And I think that is where my focus is today. And adolescents as a group, which I have been trying to understand, is a difficult group because you don't have age of consent. You need a guardian to access health services, but at the same time, these can also be blockers. So how do we communicate with adolescent communities whose language is very different from when I was an adolescent or any one of us were adolescents, and understanding what are the media and the methodologies of communicating them becomes an extremely tricky and enlightening experience all at the same time. So with that, I'm going to stop and I will focus on the technology part in the coming conversations.
You're so right, Pallav, that, but then, it's a generation, each generation is different. And like, for instance, HIV, in 1993, everyone thought that it was sexual intercourse transmission. I actually endorsed Kama Sutra condom. I was very brave, and I was being brave, even though there was a lot of like resistance from a lot of voters from my side and said like, "What are you doing?" But I did because I felt that people should have safe sex, and of course I also thought of like the bursting population of India. But today, like you rightly said, the adolescents have, and of course when the adolescents of course are changing, and it is something that is a continuing thing. So yes, leaving it at that. How about शिवानी, तुम कुछ कहना चाहोगी अपने मतलब अपनी हिस्ट्री के बारे में, कुछ
Hanji.
छोटा सा 2-3 मिनट में?
Yes. Hi, my name is Shivali Chetri. First of all, very good afternoon to everyone. So I'm professional dancer, actor, and model. And my experience, and I wish you a very happy AIDS Day today. And my experience was like this. It was, I used to, I'm a trans woman, so I'm not having any work. I'm not getting any work. So before 2, 3, 4 years, I was dancing on a bar. I was dancing on an orchestra and as a dance performer, as a soloist. So I used to ask the girls, how you, if you go out with customers and how was the experience. And one girl said to me कि दीदी uh, मेरे पास 5-6 कस्टमर्स है, मुझे 5-6 कस्टमर के साथ जाना पड़ता है और मुझे सबके साथ जाना पड़ता है और सम टाइम ऐसा होता है कि कोई कस्टमर सबके सब ये चाहते हैं कि मैं बिना प्रोटेक्शन के सेक्स करूं, राइट? तो फिर जब ये हम बात करते हैं कि बिना सेक्स के प्रोटेक्शन करने का, तो इसमें बहुत सारे चांसेस हो जाते हैं कि एड्स के पॉजिटिव होने के। तो फिर वहां पे लड़कियां क्या करती हैं कि वो चाह के भी ना चाह के भी उनको करना पड़ता है और कभी-कभी जो कस्टमर के साथ प्रोटेक्शन सेक्स कर भी रहा है तो वो प्रोटेक्शन नहीं यूज करता है, तो इट्स गोइंग टू बी क्वाइट डिफिकल्ट फॉर देम टू सेक्स बहुत जल्दी उनको पॉजिटिव होने के चांसेस है। तो फिर ऐसे अगर मैं हमारी बात करूँ ट्रांसफॉर्मर्स की, दो जिनको जॉब नहीं है, काम नहीं है, जो अनएम्प्लॉयमेंट है, उनको इस समाज में काम नहीं है, तो फिर वो लोग मोस्टली सेक्स वर्क करती हैं। तो फिर जब सेक्स वर्क करती हैं, जब मैं एक गौरव एनजीओ में काम करती थी मेल सेक्स वर्कर के लिए एज अ पहचान प्रोजेक्ट में जब काम करती थी आज से 3-4 साल या 5 साल पहले, तो हम लोग कंटेंट डिस्ट्रीब्यूट करते थे सेक्स वर्कर को, लोगों को जो लोग ये मतलब प्रोफेशन में काम करते हैं, प्रोस्टिट्यूशन में जो हैं। तो फिर कई बार जो मेल सेक्स वर्कर हैं या फिर जो ट्रांसजेंडर प्रोस्टिट्यूट्स, उनका ये कहना होता है कि सेम सेम आंसर है कि उनका, कि यही कहना होता है कि हमको कस्टमर्स प्रोटेक्शन, कभी कभी सेक्स करते हुए प्रोटेक्शन यूज नहीं करते हैं, बिकॉज बिकॉज मेंस आर डोंट वांट टू अलाउ देम कि हम प्रोटेक्शन यूज करें। तो इस टाइम पे ज्यादा चांसेस हो जाते हैं कि एड्स के पॉजिटिव होने के। सो सब कभी कभार जब समाज में पता चलता है कि इस पेशेंट को एड्स हुआ है, तो वो हवा की तरह देखते हैं इस चीज को, बहुत बड़ा चीज की तरह देखते हैं कि अरे इसको एड्स हो गया, एड्स हो गया। फिर उसको छुआछूत की भावना हो जाती है। लोग उनको छूने से डरते हैं, उनको हक करने से डरते हैं, या उनके साथ खाना खाने से डरते हैं, या उनके साथ बैठ कर बात करने से डरते हैं। पर मेरी लाइफ में बहुत सारे ऐसे एड्स पेशेंट आए हैं, पर्सनली वर्किंग एज अ सोशल एक्टिविस्ट फॉर अ ट्रांसवुमन एम्पावरमेंट। So many transgenders and so many people are used to come. I used to sit with them, I used to talk with them, मैं उनकी प्रॉब्लम्स, उनकी लाइफ की प्रॉब्लम्स और उनके ये जो पॉजिटिविटी के बारे में जो बात है, मैं हमेशा बात करती थी और जानने की कोशिश करती थी कि लोगों की लाइफ में प्रॉब्लम्स क्या चल रही हैं। तो मैं उनको सॉल्व करने के लिए, एज अ एम्पावर के लिए मैं इन चीजों में काम कर रही हूँ। तो फिर बस मेरा यही कहना है कि ये जो हवा है ये चला जाना चाहिए। अभी भी ये हवा गया नहीं है, अभी छुआछूत की भावना गई नहीं है। लोग ट्रांस वुमन के साथ, या जिन ट्रांस वुमन को एड्स है, जो पॉजिटिव पाए गए हैं, उनके साथ अभी बैठने से डरते हैं, गले लगाने से डरते हैं, उनसे खाना खाने से डरते हैं। तो मेरा यही कहना है कि इस समाज से ये हमें निकालना है।
बिल्कुल सही बात है। पता है शिवानी, ये जो ये है ना, तुम जो कह रही हो हवा, ये हवा जो है ना, तो मेरा भी ये सोचना है, बिल्कुल तुमने सही बात कही, ये हर आदमी में हवा होता है। तो हम कहते हैं कि जी हम ये निकाल देंगे, HIV निकाल देंगे, ये कर देंगे, बट तुम पर्सनली, ईच एंड एवरी पर्सन हैज टू टेक आउट दिस ब्लडी हवा यार, तभी तो आगे चलेंगे। दैट्स हाउ दैट एक्सेप्टेंस हैज टू कम, राइट?
यस यस।
ठीक है, correct. Apurva, I know that you have been working with UNICEF and you do work with adolescents and AIDS. So we'd really like to know, firstly, about this is the first 2 minutes where we want to know about you first, and then we'll get into your job.
Thank you so much, Anu. And first of all, congratulations to you for bringing this topic and talking about it. It's really rare to have celebrities and people who are real influencers making this difference. So, my compliments for that. And I'm
Thanks.
a
But by the way, I'm a master's in social work. So I am with you guys. With
we are,
accident, I've become a model and actor.
so
Yeah, go on, go on. Sorry, go on. Yeah.
so I'm a medical doctor. Basically, my background is I'm a gynecologist, and I
Uh-huh.
moved into public health after my clinical because of various reasons, and have been working for UN now for almost and the public health sector for 15 years. And I would recall some of the instances and experiences during my clinical days where adolescents would come to our clinic, to the outpatient department, and the kind of apprehensions everyone had, or even the judgmental attitude even the
Mm,
clinicians or the doctors or staff would have. So it was not
mm,
only the adolescent who was feeling uneasy to ask us queries. Even from our side, we were not sure how to handle this because we don't know how to
correct.
handle that age group. So it required lots of confidence building and lots of trust building first, and that is where we I think we used not used to have enough time to counsel. So counseling was one part that was totally missing. And now when I'm into this sector working with UNICEF and seeing all the different kind of programs, that was one thing which I felt required lots and lots of interventions. And talking to adolescents, they know their
Right.
problems best, and they also know the solution. You are just
Correct.
required as an catalyst or an agent to help them follow their own solution, but we usually tend to give our solutions. So that was one big
You're so
learning I
right. Yeah, absolutely. The thing is that, like they say, that we need to learn from our own children. And adults think that we know everything, but there is a completely new and a different point of view which a child can bring, which I mean, I'll tell you, with when I started, even with my foundation, my first focus was children and adolescents, from the age group of 6 to 12, and the youth to 21, because I feel that they also, the adaptive power is higher.
True.
You can when you tell them something, when you teach them something, they learn faster. Because human beings, when as they grow up, as they become adults, there's so many layers of difficulties, problems that they face in life, personal problems, job problems, blah blah. So, these layers start to form,
True.
and they start to cloud our childlike innocence and the way to learn, and the our approach towards life and knowledge, which is fresh, that freshness, right?
True.
And and i so yeah, so great. I That was lovely hearing you.
And if I may just add, there's also clear evidence that if you invest in
Right.
adolescents, it gives you triple dividend. You are not only affecting their immediate health, when they are getting into adulthood, it affects their health in a very positive manner. And also when they
Right.
become parents, it affects the health
Hmm.
of their children. So you are doing
Right.
one investment with three times return. So it's very important to
Correct.
invest in adolescents. Thank you.
That is true. Yeah, no, that's true. So, Joseph,
Hi.
Elvis, not Elvis Presley, but
That's right.
Elvis.
Elvis Joseph.
Yeah,
Hi,
Elvis
good
Joseph.
morning to everyone out here, and thank you for giving me the opportunity to be here as a part of you all and have this discussion, which is very very important. To begin with, yes, I'm a former national athlete, and I've been working in the space with HIV for almost 15 years for now. I had a very early opportunities in the very early days in my college with an initiative by the college which started called the Joseph AIDS Awareness Movement. So it was the very first time we all got introduced. We didn't know what AIDS was all about. I'm talking
Right.
1986,
Hmm.
87. We heard it. It's something that it's a very deadly virus that kills people. I mean, we didn't have any information. But the moment when we got involved with what AIDS is about, trying to understand, and this club really opened doors for us. So the college created a good platform for us in terms of understanding sexual behaviors, understanding the society, with the complex society that we have, and the kind of information that we get, and the things that what youth want to explore with. So it was pretty dangerous at that point of time to understand. But later, after having a long, after my college, I had a good opportunity to be in the corporate fraternity. I worked for a banking sector, and then for almost 10 years, and then came back, and I wanted to get back into sport because there was a lot of empty space that in my heart, and I always wanted to come back and say this is where I belong. So I made a decision to quit my job, and then I said I want to come back to sport. And when I started back again in 2000, later in the 2000, then I had this opportunity to meet all my friends and said, let's start something new. 2009 was the time we had this foundation we wanted to start for children. And
Right.
largely we were thinking that sport is a good platform for everyone, and because we benefited out of it, as today we become athletes, and some of them have become international athletes, and the kind of exposure, the kind of influence that they can bring upon civil societies, and the kind of work that people do in the civil society. So I had this opportunity to meet with one of an organization, a faith-based organization called Sneha Dan. And I, for the first time in my life, in 2009, when I saw of children living with HIV, and they were really, healthy. I would not say, unless you're being told, you wouldn't know the child is HIV positive. So I thought it was an orphanage, and I got introduced through one of my relative, and we happened to be there for a program. And then later I had a conversation with father. I said, what can be done for these kids? Because it's just not about providing food supplies, or looking at them, saying that you need to give them some kind of compassion, and just be with them to help them with education and stuff. But there's something more that these kids can do. So came back and prayed over it. To be very honest, my journey began with prayers. I said, Lord, this is the only gift you have given me in sport. What can I do with this gift? And in the week, we started spending more time with the kids, and we came up with this project called Champion in Me. It's basically a project which you use sport as a platform and how you empower the lives of children and youth. Basically, I understood that with HIV, it is the immune levels for any child or any adolescent or any person. It's the challenge with the immune system. You have a weaker immune system, and then you're really crippled. You really can't be efficiently doing things that you're supposed to do. So, how sport can be a platform that can really build the immune system? That was a larger focus. And secondly, how do you really create an opportunity for them, to be on the mainstream to eradicate stigma and discrimination, which was a global agenda to eradicate stigma and discrimination. So, how can we contribute into all these things? So, we created this model called Champion in Me and inducted this among the kids. And today we see there's so many milestones that's been achieved over a decade for now. And today this has been a success model, and we would love to have this replicated across India and as well as taking it to different countries. So that's where we are today. So this is my part of advocacy and the programs that I do in terms of building lives of children and youth living with HIV through sport. So I use sport as a platform. Yeah, thank you so much.
Great. I mean, yeah, each of your stories are so different and so diverse and yet so connected, because eventually it is the same cause that we are all working for. And so, Palak, we are going into the second phase, and now we want to talk about what is your, what the real active things, your work things with the AIDS and in COVID. Is what are the challenges you're facing because of COVID?
So one of the issues which we faced in COVID early in this year was access to medication, and so somebody who tests HIV positive needs to take the ART drugs, regularly, and it's important. Like Joseph was just mentioning, it's about immunity. So you need to keep your immune system in good shape so that you don't succumb to the infection, or that viral levels in your body, do not increase, or your immunity remains strong. And what we could do with technology early this year was to ensure that health workers were armed with, with apps, and they could actually go to the end of the road and go to a person's, a particular space which was convenient for somebody who has paid HIV, and actually deliver the drugs at a specified location and complete the circle of actually giving the drugs at the specified location. And this kept the adherence, as it is mentioned in HIV terminology, to a high level. Now, what we also had started early this year was started to create content for people who are just testing positive. So and a lot of the problems are people who do not accept their PLHIV status, because it is important they understand that if they test positive, that they continue taking their drugs. And most of the time, people might go in, say, I don't want to take the drugs because there are side effects, and they need to be educated about that there will be side effects, but you need to keep on taking the drugs. What happens at ART centers is sometimes the load on the ART centers is so high that the counselors do not get adequate time for counseling, the mental health part which you were speaking about, and you sometimes do not, in your own homes, you're not able to actually talk about your PLHIV status to your own family for a long period of time, because you have yet not come to terms with it yourself. Imagine having to have this conversation with your parents or with people close to you. So how do you bridge that gap with the right content, which is going to tell you that you need to do the right things in terms of taking your drugs and medication on time, to ensure that you curtail activities such as smoking and drinking and keep them under check, because they may interfere with your ART drugs, and having adequate nutrition. And third, how to reduce risk of infection. You do not go into eating food stuff from stalls or whatever and kind of keep your infection high. And but that information is just not available sometimes to people who come at the ART centers. And technology, we realized again in urban settings in Mumbai, people will say, hey, but smartphones are not, it's not a poor man's, way of communicating. And we realized that at least in urban India, most households have at least one phone, and everybody has a smartphone, sometimes even a hand-me-down smartphone. And that was not true. We could use the smartphone as a technology intervention to people. Uh, we also put kiosks at different, MDAX invested in kiosks at ART centers using a digital interface to have the same videos and the same content for people. And this year, we are now curating content specifically for adolescents. So maybe after this call, I might just get in touch with Apurva and see if if it would be helpful to UNICEF, or they can give us content to kind of curate stuff for adolescent youth. Because what we are noticing is that you need to, most of the adolescents who are HIV positive look at their own HIV status as something that's going to block their future growth, and I'm sure Joseph also deals with that, as to tell them that you can achieve whatever you want in your career, you can do whatever you wish to do in the future. All you need to do is have this particular aspect of keeping your HIV and your viral, load in check. We do that from a viewpoint of technology and using technology as an enabler to reach out to them using digital technologies or whatever. But at the end of the day, every technology also has to have its heart in the right place. And that is
Right.
usually told to us by social workers or people on the ground who also tell us how the technology should be. So you have to maintain confidentiality issues, you have to maintain certain sensibilities around technology. You have to also understand that the user is comfortable with the technology. You can't have something so sophisticated that the person doesn't know how to handle it. And so when you create technology, you also understand who is the end user for whom you're creating it for, and enabling the end user as well as the health workers, because now the health workers know which of their patients are adhering to their drug regime, have mental health issues, so that they know they can give specific attention to those people and give them specific referral services in case that is needed. And that's what we work on in that area using technology to further accentuate and improve the efficacy of HIV.
Well, how do you, yeah, so that's great. But how do you, when you say that you're working to increase the mental health through technology, can you just, how do you do that? Very briefly, because we are
So
moving on
one
to
is,
the next person.
yeah, one is obviously the content through the videos, and the second is if you within the apps you have how are you feeling today, so you can say I'm feeling good, I'm feeling bad, I'm feeling worse. So the counselor sitting in an ART center will get a report showing how what are your mental health scores. If a person is repeatedly showing low mental health scores, then this person can be identified for an intervention for mental health. So it only improves communication, and it improves identification of people who may show less adherence in case they are having mental health issues.
I think that that's really nice. And I have actually there's certain very, very easy meditations to be done. And before an adolescent, it can even be done by adults before they go to bed and when they wake up. And it's there's certain very simple things they'll do which will raise the happiness quotient in them, and plant positive affirmations in their mind, which we also desperately need. And definitely people who are suffering from a stigmatic problem like HIV positive, right? So yeah, so we are going to talk about it, Pallav, later on after the this as to how we can, and of course Apurva is going to be involved in it. So we're going to have a chat after. But right now, let's go on to शिवानी. तो आप ये बताएं कि और आजकल के जमाने में आपकी जो जो आपका डिसीजन है, क्योंकि it is not a very common thing, है कि नहीं, right? There are a lot
Yeah,
of people go through what you, it's a decision you have taken, that
yeah,
I am going to be, I'm I want to be, I am a girl,
Yes.
and I'm born in a male body, but I am a girl, right?
Yes. Obviously,
And I
yeah.
will go through whatever it takes
Yeah.
to show the world that I am that. I think it's an amazing, and it's a powerful thing. Not a lot of people take this sort of decision. So now, just let us know how you are going through in the COVID time with us. Just give like a couple of a couple of minutes. You have a minute
Yes.
actually.
COVID time is really gonna be a difficult for me because to be as a trans woman in the society, there is no work because every day is not shoot, every day is not a catalog shoot, every day is not a photo shoot, every day is not like there is assignment for acting and modeling also as a dancer, as a soloist, as a performer, right? So to very difficult for me to survive in this COVID-19, but I'm just getting some help with my friends, those who really
Mhm.
would like to help me and those who really accepted me a lot. Okay, you are trans daughter, you are a trans woman, it's okay, no problem. So so sometime because everything is shut, everything work is shut, so it's really going to be a difficult and survive. And uh, I just want to share one more story. When we have to go, when we go to the when I used to dance on a dance bar orchestra to survive myself before 2 3 4 years, when I did my surgery and all, breast implant and the transitioning things and a hormone treatment and all, right? So when I used to dance there, so they call me a prostitute only, right? If I'm that performer, uh, so they're going to be not accepted me as a dancer or soloist, so they think like that it transgenders are a hijra or eunuch, they only made for doing a prostitution or a BJ, a blow job. Because I'm also a trans woman daughter, so I'm not if my soul not allowed to do a prostitution, so I'm not do that, I'm only a dancer, but people call me like this. And people, why I really don't know people why they think like that, because I have a really bad experience with one senior journalist also. He told me that transgenders are born for to changing herself, and then they just going to be उनको HIV ट्रांसमिट हो जाता है और आखिर में वो एड्स से मर जाते हैं। क्या यही समाज ने हमें अभी भी समाज एक अनएडुकेटेड है जो ये सोचता है, या ये ऐसे एडुकेटेड जर्नलिस्ट भी ये सोचते हैं कि ट्रांसजेंडर सिर्फ बॉर्न हुए हैं सिर्फ प्रोस्टिट्यूशन करने के लिए, और वो आखिर में उनको एड्स हो जाता है और मर जाते हैं। In also I have like I have, because I've done my couple of surgeries and मेरा अभी sex change बाकी है. It's like one more surgery left. It's called sex change. Why my mother elder sister, she's staying in Nepal, and she's talked to my mom and she said कि जल्दी से उसका sex change करवा दो वरना उसका HIV हो जाएगा. Why she think like that कि अगर वो मेरी बहन की बेटी अभी ट्रांजिशनिंग में है, अगर उसका सर्जरी एज सुन एज पॉसिबल नहीं हुआ तो शायद वो गलत रास्ते में चली जाएगी या उसके एड्स हो जाएगा। तो ये ऐसा उनकी साइकोलॉजी थिंकिंग क्यों है, जो आज से जब ये मैंने महसूस किया, जब मेरी माँ ने मुझे ये बात शेयर की आज से 4 5 6 साल पहले, तो that time I was a very I'm a dancer. I was working with prostitutes as a dancer in the bar. जब bars बंद हो गए 2015-16 की बात है। बट दैट टाइम आई डोंट नो कि प्रोस्टिट्यूट्स डांस करने के बाद बाहर जाती हैं कस्टमर्स के साथ में, राइट? उनकी भी मजबूरी है, बट इट्स नॉट मीन लाइक दैट कि लाइक अगर मैं ट्रांस वुमेन्स की बात करूं, इफ दे आर डूइंग अ प्रोस्टिट्यूशन आल्सो, इट्स नॉट मीन कि उनको एड्स होना ही है। अगर एड्स होता भी है तो उसका क्योर है, उसकी रेगुलर मेडिसिन है, जैसे मैं पल्लव सर ने बताया, राइट? जो उनको प्रॉपर वे में लेना पड़ता है, so there is a lot of difference, depression and anxiety, and because of कि मुझे AIDS हुआ है, and they're not taking a medicine properly, they're not going for a counseling properly. I think we need to educate the people. I think I need to educate the educated people also why they think like that कि people are born, transgenders are born for only for prostitution and transmitted diseases for AIDS. Thank you, Anna.
Shivani, what you are saying, na, ki people's awareness needs to be raised, and this is what
Yes,
my foundation is doing.
yes, yes, yes.
People's awareness needs to be raised, not just about causes, not just about issues,
Yeah,
but people's awareness needs to be raised about themselves. The
yeah,
power of health that each person holds within him. Okay, so we We will definitely, yes, I agree on this. So, Apurva, you want to talk about what is the issues that are coming up with COVID as far as your work is concerned?
Yeah, no, definitely. And I think it started with what Pallav said, lots of mental health issues. And what we are seeing is that, especially for the adolescents living it with HIV, it's like a double whammy. They were already facing all the restrictions and discrimination and issues with pertaining to HIV. And now this
Hmm.
COVID has affected them with an additional burden where it is already they're at a greater risk to weaken their immune system, and also finding the antiretroviral medicines. And also there's a prolonged stress on the health system, which is adding to
Hmm.
the disruption of services. You can see the way the medical community has been tirelessly working, but now it's like a long marathon, and it has to sustain for some time. So especially when you have to prioritize your resources, that's a situation which is emerging, that usually the adolescent health takes the back seat, and more of the immediate issues take more of the attention, and your health workforce is also getting diverted towards it. Also in terms of the migrants, the vulnerable, so within the adolescent it's not a uniform community. There are adolescents who are migrants, who are single adolescent taking care of their siblings. There are adolescents who are not going to school. There's lots of digital inequalities this generation of young people is facing. While some have very good access to information and services and internet, there are kids who are losing on education because they are not able to go to school, not able to meet
Hmm.
friends. And then not everyone is having access to computer at home. So earlier they were going to school, and the kind of stress it is creating on these adolescent children and adolescents and children, because by virtue of that age you want to run around, play with your friends. Now you're confined to room talking on virtual spaces. So it is taking a toll not only on their mental health but also physical health, restriction of activities, and the kind of eating habits people might be adopting, or even the cyber space crimes and other things they are engaging into digital media. Definitely some of it is very good, but then we don't know what is happening on the other side. And also a very important issue where the adolescent girls tend to get disproportionately affected by all these pandemics, and we have seen these in emergency situation, children, adolescents and girls. And there are instances where we know that the violence is increasing. They are at higher risk of gender based violence, and they are at higher risk of access to not having adequate access to resources and money to spend on their own health and well-being. So these are some of the challenges which are definitely emerging during COVID times. But also I would like to reiterate that there's also a huge opportunity that has emerged with COVID. Now we have access through these digital platforms. Now we have
Hmm.
teleconsultation services which were never the way they are now. We can reach out to experts. The reach has become much easier compared to the other times. And also this wealth of resource which agencies have produced, and I would like to respond to Pallav that yes, UNICEF also has a good number of resources developed for psycho social well-being, mental health, and lots of initiative and interventions going on. So it would be really good to bring all partners together and work together. Over.
I think that's an absolutely great idea. So we are all going to have a chat after and see how we can actually pool our resources and help on a bigger level.
True.
What do you think, Elvis?
I completely agree with Apurva, because we have gone through all that you mentioned, Apurva, over the last 7 months, 6 to 7 months now, and it's still a bigger problem, because what we see, because we work both with institutions as well as community networks, and the opportunities and privileges are too different, for children and youth who are with institutions and who are in the community as well. The bigger problem we still face, as on even till yesterday, is life-saving essentials, is food supplies has been a huge
Yeah.
crime. And access to medication, yes, people in the institution have certain kind of access with ART centers, and yes, there's not much of a problem. But with the community, it's been a huge problem. Though we have a lot of volunteers, working with the ART centers and trying to help them have medication reach their homes and stuff, but somewhere there's a huge gap with agencies not functioning with a proper agenda. Could be government agencies, everybody in civil societies. There's a communication gap, in terms of how do we bring resources together and make this more viable, more accessible for people. But that structure is never being done. Um, yes, there is opportunities. Again, even now it's not too late. Though we have come together and we've tried our best, to make these needs on a day-to-day basis made available, but still it's not a one-time support. You need sustainability to this. You need more partners, you need more people, because life-saving essentials, hygiene essentials are on a day-to-day basis. These are the needs, and especially with children and youth. um, it's really impacted them, because see, for example, sport program, they've been on a day-to-day routine, and every day, this is your timing: morning at 6 to 8, this is what you do, and evening 3 to 4:30, and this is what you do. Now that entire system has, it has crippled them. They don't know what to do. How long can you sit into a room, and how much of material do you have? How much can someone talk to them? So individually, they are all disturbed. Now this is the time they've come together about talking about their families, about the fear factors that's raising in them. So it's really mentally they are shaken up. But now again, we've revived the program where individually in twos and in threes, where we form smaller groups, and we've changed our whole training pattern as such. We're trying to cope. We're trying to work out something new. We'll see that in the next assessment, probably in Jan, to see how they have gotten better. But largely, our problem still lies is with life-saving essentials, which has not been addressed. And though we've reached out to many platforms, small and big, but the response is not very good. So yeah, I think that's something that needs to be addressed, and this is a huge problem for children and youth living with HIV during this COVID. It's the life-saving essentials. Yeah, over.
Yeah, exactly. Thank you so much, Elvis, and all of you. I think we'll have to be ending soon because the time is up, and I think that at the end of it all, is there any one line anybody wants to say? Because I just feel that this itself, this conversation itself, is raises awareness about the issue. And there are a lot of facts which are sort of unknown to the normal masses, which come to light here. So I think that this is really helpful. And if there's anything anybody wants to say, otherwise we are. Thank you very much. And yes, anyone? No.
Yes,
Okay.
this has been our one of our kids. I want to share this with you, with all of you all.
Mhm.
One of our positive kid who went for the Children's Olympic, which was in 2015 in Netherlands, and on a platform. It was the first time ever we had two kids on a global platform. Giving them the equal
Mhm.
opportunity and the right to play sport. He shared this beautiful line. He said, "Take the lead and keep the promise." So today, I think we are all still here and being given this opportunity again to take the lead and keep the promise. So I think we should continue with our work of advocacy in whatever area that we are trying to support and work and make this community a better community for all of us.
Thank you so much. And thanks everyone, because I think that one of the things is that, of course, when we go into the holistic science of India, which is remarkable. By the way, even I didn't know, like all of you, like all of us, raised in the city, have absolutely no knowledge that there are just sound. It's just sound mantras which you can, like, 5 words that you can say in the morning, and they can boost your energy levels for the entire day. So, I mean, I think that those are the kind of things that we need to include in the everyday curriculum of all children and all adolescents everywhere, but definitely some special focus to be given to people with like HIV positive. And so, just to let you all know that HIV is a very serious disease. It is a very serious disease.
I'm not able to hear Anu.
I think she's lost network. But yeah, I think what Joseph mentioned was quite a lovely line. Thank you, Joseph, for sharing that with us.
Thank you, Pallav. Yes. Apurva, just a quick question. I'm sure even Pallav had raised in terms of resources, because like even in the community right now, not everybody is accessible, and we have very less people in terms of going out and training because the restrictions are really crazy. Especially at the district levels, restrictions are so much. Every time when we want to enter into a certain district, trying to get permissions to get through there.
Agree, completely
So
agree with you.
we are really crippled. Civil society is really crippled, though they are all
Mm-hmm,
on the forefront, to fight any kind of challenges.
mm-hmm,
But I see that the bigger organizations really don't support much, and even they're not with you, as much as you have access to them. And but
mm-hmm.
on ground realities, I don't see that kind of an action happening from government agencies or other agencies across. So that leaves us with very little. That leaves us to make poor choices as well. So what do you do?
Mm-hmm.
And that really, this whole cycle again, so you see how the children are being impacted mentally, physically, emotionally, and all that you've invested all these years, it just becomes a big meaningless, completely meaningless. So if UNICEF in any way can, tell us, give us a guideline, tell us this can be, an avenue that would could help civil societies first, because they are the people
Yeah.
who do a lot of work.
In fact, I'm happy you raised this question because COVID was the time which helped us enter into partnerships which conventionally or which so far we had not had. We were engaging, but not to that extent. And one of our very important partnership with is with the Sphere Academy, where we have created this platform together with WHO to engage civil societies. And Sphere Academy, I'm sure you must be aware of, has around 700 civil society members attached to it, and we are bringing experts, we are bringing people from all arena and using it as a capacity building platform for the civil society members, and it has been really very successful, and we are into second phase of Sphere Academy platform. So if there is an issue which is pertinent, important, and we want to reach a certain sector or a group, be it, and we started with civil societies, but then it moved on to healthcare providers, program managers, frontline community workers, even to NDMI, we were using this platform. So this platform is available, and we'll be very happy to provide this opportunity to you or any other organization who wants to engage with us and come up with a session or a webinar or a capacity building on these topics or raise awareness, reaching out. So this Sphere Academy platform is available with us. Then in terms of mental health, we have created lots of tools, resources, kits. So those we will be very happy to share, and I can immediately share it after this. It's across various languages. Then UNICEF also has a partnership with the NIMHANS, where we are supporting people with psychosocial counseling and mental health issues, where engagements are with the psychologists and doctors, and our child protection team is working, and my colleague. So I can make those connections, and you can further take that discussion forward. So there is lots happening around, it's only bringing it together and, like we said, sharing it with one another. Similarly, in Gujarat, Gandhinagar, our colleagues, they are engaging with Public Health Foundation of India and the Indian Pediatric Associations to raise awareness, to provide counseling services, or even to extend health services. Also, we are engaging in tea gardens in Assam, where we are supporting the peer educators, because tea gardens were very badly affected by COVID in terms of access to services, information. So there's lots happening around, and we'll be happy to share and engage and connect with the right people and provide whatever platforms we have to share. So
Okay. Thank
yeah.
you. And also, just another point I wanted to also raise, with currently what we are facing here, largely in Karnataka, I would see, with adolescents, like when you're 19, the government really doesn't support you with the childcare policy. The act doesn't really support for a 19-year-old and onwards. Now, most of them cannot even stay in those shelter homes or the orphanages where they grew up, or so they have to move out. Very few of them have families, and now they have to look in for opportunities in the community to go and survive for themselves. Now that's another big threat, the fear of for almost all the girls and boys, who are
Mhm.
18 and 20s, they're going through a very rough time at the moment. So
Mhm.
talking about this mental health, and they're not willing to even take that, because at this point of time, what's needed for them is security, is some kind of
True.
security. And food and shelter is a very basic thing. And then comes, because all these years, it's institutions which provided, even with communities, yes, some amount of support system was given to them. But largely, this has been a big neglect with children and youth. And I see this during the time of COVID. It just erupted. It just, opened out
Mhm.
right in front of our eyes, and we are helpless, because we every time we have to go back and depend on those agencies, whether it's government or other agencies, and there's very less that is being done from them.
No, I completely agree. There are lots of issues, and with COVID, these issues have further gone up.
Yeah.
Earlier, there was a community of adolescents who were facing it. Now, it has spread wide across with new vulnerable groups who are also emerging, and their needs and their requirements. So, definitely, this is a point of discussion where we all should be brainstorming more further, and all agencies coming, and we'll be happy to take this discussion forward separately. I'm sure we'll connect
That's
with our
so, that's,
colleagues.
yeah, thanks, Apurva. That's so heartening because, we all think the amazing thing is that we're all like in different places, but we are all connected with the same sort of work that we are doing in maybe in different ways. So let's definitely get together and help each other and help the community and help the world. And as I was saying that we can we'll meet next time. Thank you very much. Namaste. All the
Thank you.
best.
Thank you so much. Bye bye. All the best. Have a
Thank you,
nice
everyone.
Thank you so much. Thank you so
Thank
much.